This video is to show how to give narcan or naloxone for overdose using the Evzio injector. And this presentation has not been approved or endorsed by Wayne State University, and they are not responsible for its contents. So the first thing is, what's naloxone? Naloxone, the brand name or the common name for this is narcan. It is an opioid blocker that goes to your brain, and if you've taken an opiate and overdosed, it will kick the opiate out of your brain and start you breathing again. However, it only lasts for a few minutes, and heroin may last for several hours, and other drugs may last longer also, depending on what's in the heroin. So once somebody has had an overdose reversed, it's critical that they go to the hospital to be watched, and they will very often need more medication. This will not treat your addiction. It's not a way of treating addiction, because eventually something goes wrong and you don't wake up. So it's not a way of preventing yourself from dying from using heroin. It is also not Vivitrol. Vivitrol is naltrexone, which is a cousin of naloxone. It's a monthly shot that's given to prevent you from overdosing, and one advantage of that is that it is stronger than fentanyl, which is something we're going to talk about, where methadone is probably not stronger than fentanyl, and Vivitrol is probably a better way of preventing an overdose than methadone is, but you have to be switched over in order to take it. And this treats an overdose, again, but doesn't prevent one. So what does Narcan not do? It doesn't treat an overdose that is caused by alcohol or sedatives, which is typically Xanax, Valium, Klonopin, muscle relaxers like Soma, or an overdose or a stroke or heart attack caused by cocaine or amphetamines. But if there is more than one drug involved, let's say that you've injected heroin and there's Xanax in it, the heroin part will be reversed by naloxone, and this may be enough to keep you alive until EMS arrives. There's different ways of using Narcan or naloxone. It can be given as a shot. It can be given as a nose spray, and the new version of the nose spray is called Adapt. Or it can be given as an injection with a special kit called the Evzio injector. And that's what we're going to be showing you today. And then this is our therapy dog, Olive. So who is going to overdose from opiates, especially heroin? Anybody who has been clean for more than about 2 weeks. And that may be somebody who's been in treatment, someone who's been in jail, or someone who's been clean for a while and then relapses. Anybody who stops their medication-assisted therapy, MAT. And that can be either methadone, buprenorphine, which is Suboxone, or naltrexone, which is Vivitrol. Anybody who mixes an opioid with a sedative, and that's going to be either alcohol, Xanax or Klonopin, or muscle relaxers. And as you're aware, we don't allow the use of any of these here in the clinic. And the most dangerous one is fentanyl. Fentanyl is a drug that is designed to be used for anesthesia during surgery. So it's a drug we can give you that causes enough analgesia so that somebody can open you up. It is being manufactured now supposedly in China and Mexico and shipped up and mixed with heroin. And about half the drug screens that we have here in our clinic that are positive for heroin are also positive for fentanyl. Methadone may not protect you against fentanyl, meaning that you can still overdose and die even if you're taking methadone. So you have to realize that it is not a good solution if you're still using and you're mixing with fentanyl, and that may be the reason that you may be referred for a higher level of care. So we're going to talk about how to do a naloxone or a Narcan rescue. The first thing is to make sure they're not breathing, and also we'll talk a little bit about comparing this to having a heart attack and doing CPR. Always call 911 even before you start doing anything. And the reason we recommend this is that this is the one step you're going to forget. If you don't call 911, even if you revive somebody, it's going to wear off, the heroin's going to kick back in, and you're going to be back in the same boat. You're going to do rescue breathing, not compressions like you do for CPR, and we'll talk about the difference. And rescue breathing is because when someone overdoses on opioids, their brain has stopped telling them to breathe, and you die from respiratory failure. When you've had a heart attack, your heart stops, and that's why you do CPR and chest compressions, and we'll talk about the difference. You're going to give naloxone, and the example we're going to give you today is going to be the injector, and you're going to have hopefully 2 doses available at least, and you want to give them 3 minutes apart. After you give the first injection, you're going to go back to doing rescue breaths about every 5 seconds, and 3 minutes later you can give your second injection, but after that you're going to be out of the injectors, and you're just going to have to keep doing rescue breaths if someone has not woken up. Again, you're going to repeat the Evzio injection every 3 minutes if you can. Now, the first thing is you want to confirm that it's an overdose, and usually this is somebody that you know has been using opioids, or someone who knows you, and they're going to see you either not breathing, or you're going to be gurgling or snoring, and just breathing a few times a minute. Your skin will be pale or clammy, your body will be limp, your lips will be blue, or your fingernails will be blue, and you cannot be woken up easily with the shouting. But one thing to remember is just because somebody has a pulse doesn't mean that they haven't overdosed. And one problem with checking for a pulse and doing CPR, if you can't find a pulse, is that up to 50% of volunteers will miss a pulse when they check it. So if this is somebody who you know is using and you find them suddenly unconscious, the most likely diagnosis is going to be that it's an overdose and not a heart attack. And if you think that it's an overdose, you want to start rescue breathing. You want to get them flat on their back. So if they're propped in a chair, drag them on the floor. You want to tilt their head back, and what that does is open up the airway. You will probably not have a breathing mask, so you're going to pinch their nose, and you're going to give 2 breaths to start with, and each breath should be 1 second long, and you don't want to breathe too deeply into their mouth, because if you're too enthusiastic, what you can do is you can injure their lung, and the air will escape from their lung and actually collapse their lung. You should see their chest move and not their stomach, not their abdomen. If their chest doesn't move but their stomach moves, then you want to tilt the head back farther, because you're probably blowing air into their stomach. Now, if you're not sure whether or not they've overdosed, or if they're just sleeping, you can do something uncomfortable first before you go ahead and start rescue breathing. You can do a sternal rub. You can rub under their nose. You can squeeze their trapezius muscle, which is the shoulder muscle that's so sensitive. You can squeeze their fingernails. And if they wake up but then they start going out again, you should go ahead and treat it as an overdose. Again, you want to call 911. And if you have a speakerphone, turn the speaker on, put it down next to the patient while you're doing this, and they will help talk you through it, and they'll also let you know how far away somebody is. Now, what if you think they've had a heart attack? And this is obviously difficult for a volunteer to figure out. Again, we're talking about people who you know are using opioids, or someone knows that you've been using opioids, and they're suddenly found out of it. They may have just injected. But if you find somebody who has no history of using drugs, if they're over 40, if you know they have a bad heart or high blood pressure, and you find them suddenly unconscious and you can't find a pulse, you can start CPR instead. And again, this is a difficult call to make, and there's no firm and hard rule to tell you. You want to call 911 first, again, because you want 911 to be on their way. You put one hand in the middle of their chest, and then cover your hand with your other hand, and then start pushing 100 times per minute, and that is the beat of Staying Alive by the Bee Gees. And you can find this on the internet and find it on YouTube. You want to push their chest down 2 inches. You want to lock your arms, and you want to take your hands off their chest in between compressions, because you want their heart to be able to get all the blood back. If there is somebody else there, you can do a rescue breath every 5 to 6 seconds, but again, CPR emphasizes chest compressions, not breathing, and unfortunately, if this is somebody who's had a drug overdose, this is not going to help them, because their problem is they stop breathing. After giving a couple of rescue breaths, you're going to give them naloxone. We're going to show you how to use the Evzio injector. You can also use a regular shot, or you can use a spray in the nose, and those are both available, and you can find instructions for those on the internet. But we are going to be giving you the Evzio injector. You're going to have 2 injectors and a trainer. You may be given extra doses that have expired, and those can be used for legally for training only. But what you're going to see in the video is how to pull the cap off and give it. And basically remember that you want to give it in the side of the arm or the side of the leg where there's no blood vessels or nerves, and that's the safest place. And again, you should have at least 2 kits to give 2 injections if you need to. And then after EMS arrives and takes the patient away, be careful. You want to watch out for any needles that have been around, either used by EMS or being used by the patient. You want to clean up all the blood because you have to assume that the blood is contaminated. And you want to remember that if this is someone that you know, this is an opportunity for treatment, because this is not treatment by itself. All you've done is brought somebody out of shock, just like if somebody has diabetes, but you haven't treated their diabetes. Now we're going to show the videos, and the first one is going to be the breathing video, and the second is going to be the injection.
Did you hear about the kid who overdosed?
Yeah, is it true?
Yeah, I was there. We found him unconscious, and I swear his lips were blue.
Did anybody have narcan?
Nope.
Call 911?
Some girl did.
What did you do?
I put my mouth on his and breathed.
So again, you want to tilt the head back, pinch the nose, do a 1-second breath into their mouth, watch to see if their chest wall moves, do it again. If their stomach moves, move their head back some more and try and straighten out their windpipe. And repeat this every 5 seconds. But remember, the first 2 rescue breaths you give, you're then going to give the narcan and then continue the rescue breathing after that. So this is the Evzio trainer. You take the tab on top, pull it off.
This trainer contains no needle or drug. If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh. Then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete. This trainer may be reused for training purposes.
And that's the end of the presentation.